In these uncertain times, good health is a must. Let Quality Diagnostic Laboratory provide you with fast, accurate results of the medical laboratory tests that you need. At QDL, our qualified and experienced staff can provide a host of blood, urine, and other tests in a safe, confidential, comfortable, and welcoming environment. We are open Monday to Friday from 7 a.m. to 4 p.m. and Saturdays to 12 noon. We are at the corner of Fines Avenue and Keon Street. Contact us at info@qualitydiagnosticlab.com or call 869-465-6657. And yes, si habla español. Quality Diagnostic Laboratory. Excellence in performance.
Pleasant good night, and thank you once again for joining in to another HealthWise by the St. Kitts Nevis Medical and Dental Association. I am your host, Dr. Woodley. We sincerely thank you for spending your Monday night with us because we know you could have been doing any other thing. Our motto is working towards healthier societies. As a result of the above, we use this platform to educate and to give you the knowledge, an important tool in taking control of your health. We also help you to understand the disease processes that we are faced with within our federation, the region, and internationally. We also use this medium to promote healthy lifestyles and thus improving the quality of your life. And last, but certainly not least, we use this platform to highlight, to showcase our doctors, to let you know who they are, what they do, and where you can find them. And we also use this platform to let them know that we see you and we thank you for your sterling contribution to the health system. Let us think for a moment. If we step back, I think the health system would cease to exist. Tonight, we will be talking or discussing hand, foot, and mouth disease, something which has popped up spontaneously during this summer period. And here in the studio, I have with me two great doctors, Dr. Iles, who would introduce herself shortly, and Dr. Henry, who has been here before and would reintroduce himself to you, the people of this federation. Dr. Iles, pleasant good night, and thank you for being here with us. And tell us a little about yourself before we start this discussion.
Okay, so good night, Dr. Woodley. Good night, Dr. Henry. And I must say thank you for inviting me, Dr. Woodley. My name is Sheneil Iles. I am the Director of Community Health Services. Let me take this opportunity to say good night to the audience, wherever you may be. I am responsible mainly for our public health system, or at least in part the community. And so I'm here today to provide some insight into this disease.
Okay, and pleasant good night, Dr. Henry. Nice to have you back again. You have been here before, and I'm so happy when you took up the challenge to come back again to educate the people of the Federation. So pleasant good night, and please reintroduce yourself to the people.
Good night. My name is Dr. Yannik Henry. I am the pediatrician for St. Kitts, and we're just here to educate you on the rise or the outbreak that we have been having for hand, foot, and mouth disease.
Okay, thank you so much, doctors, for introducing yourself. So we're going to get straight into the topic, which is And normally when we go to medical school, we always start out with the concept, what it is. And this is how we normally try, well, I normally try and train the persons who come to my office. I always love them to know exactly what they are dealing with. And that is what we call the definition and the concept. So I'm going to have one of the doctors who want to jump straight into it to give us the concept of hand, foot, and mouth disease. What is this all about? Why is there a frenzy about it? So any one of you, Dr. Iles or Dr. Henry, which any one of you who want to start the ball rolling by giving us the concept of hand, foot, and mouth disease. Okay, Dr. Iles, okay. I just pick you.
Sure, no
Ladies
problem.
first.
So hand, foot and mouth disease is a mild but very contagious viral infection. We mainly see it among children, usually less than 10 years of age. However, it tends to be focused on the group younger than 5, but can also affect adults. It can spread very easily, especially among schools and daycare centers. And children are more at risk than adults because their immune systems have not yet developed the antibodies against the virus. Many times when we see hand, foot, and mouth, we see it in the summer/fall seasons, even though we don't really consider St. Kitts to be that seasonal.
Okay, so that's very interesting. So it is seen mostly in children. So as an adult, am I exempted? So should I feel, okay, I'm free, I would not get this disease because, well, I'm not a child, I'm much over that, age range?
Well, not necessarily so. So adults can get hand, foot, and mouth disease. However, their symptoms tend to be a lot milder. So an adult may have hand, foot, and mouth disease. However, they may experience just a runny nose, just to give an example.
And that is because, no doubt, we would have more antibodies
Yes.
to protect ourselves. So that is why, if we do get it as an adult, the
Yes.
symptom basically, it might even go unnoticed.
Unnoticed.
That
Right.
we would have had that disease.
Right.
Now, in terms of the cause, because it's always good to know the cause. Because once you know the cause, then you can probably sometimes avoid it. Mm-hmm. So, Dr. Henry, speak to us about the cause of this hand, foot, and mouth disease. We have some nice drawings there in the upper, well, for your TV, the upper right-hand corner there. Okay, so what are the causes?
Well, it is caused by a virus.
Okay, great.
So, and that virus name is the enterovirus. And these are viruses which are typically found in the gastrointestinal tract. They are found also in the intestines. The enterovirus, they have 4 subgroups, which is the poliovirus. We have the coccidiovirus A, the coccidiovirus B, and the ecoviruses. But for us, really, the hand, foot, and mouth disease is the coccidiovirus A is what really affects and cause this hand, foot, and mouth disease, especially the coccidiovirus A16.
Mm-hmm.
Right?
And they are really supposed to be afraid of looking at them there in the picture. So what about the ecoviruses too? They are also responsible for...
Yes, they are also responsible.
So what is interesting is that we have these viruses and they are found in the intestine. So right there and then we now have begun building the narrative and we can see, like the play unfolding.
Yeah.
So we can understand, okay, if it's found in the intestine, then we now begin to understand how we can transmit it. So, everything is now falling into place nicely. So we're going to look now on how it is transmitted, the mode of transmission. And what we have to remember, these viruses, they are found in the intestines. So it's almost logical and almost we can see exactly how it can be transmitted. So Dr. Iles, speak to us about the mode of transmission.
So, as I mentioned before, it is easily spread. And so you can have spread from person-to-person contact, whether it be through respiratory droplets, which contain the virus. If a person coughs or sneezes, you have to recognize that these particles are expelled into the air. Also contact with contaminated surfaces and objects. So the virus is on a surface, You touch that surface, you now go and place your hands into your face, your nose, and so it can easily spread. There's also, if you have contact with respiratory droplets which contain the virus, after this person, a sick person coughs or sneezes, you have to recognize that these particles are in the air, and so close enough contact can also encourage spread. If you touch an infected person, whether it be kissing, hugging, sharing of cups, eating utensils, this can also transmit the virus. Touching an infected person's feces. No, we're not saying that you're gonna see feces and necessarily go and stick your hand there. However, if you're changing diapers and then you go and touch your eyes, your nose, your mouth, the virus can spread in that manner. Also, as mentioned before, on objects and surfaces that have the virus on them, doorknobs, toys, just touching somebody else can also transmit the virus.
So if you go back to slide number 4, my cameraman, yeah. And we look at those pictures. Dr. Henry, what's happening there with those pictures?
Oh, that.
In terms of that mode of transmission, what's going on there? That is loaded.
That is why the definition states that it is most in children 10 years and below, but mostly in those 5 years below. Because look at the children interacting with each other. They're sharing the toys.
They look so innocent, you know?
The toys in each other's mouth and like playing.
My turn to taste.
So that is how it can spread, and that is why it is spreading mostly in daycare.
In daycare centers. And you know, something I need to underscore, especially when you have babies and persons come up to babies to kiss and hug and so I mean, these are, for me, these were always behaviors that I discouraged. I never liked anybody touching my daughter or kissing her when she was young, because you know, so many things can be passed on. And you spoke about the sneezing. You know, a person sneeze, and when you sneeze, that's a lot of energy and droplets that are coming out of your nose and your mouth. So that is why the mode of transmission is so easy. And I guess that is why we are seeing the spread so much, especially at this point in time. And Dr. Iles, I want you to focus on, especially for those daycare centers, where you have the workers changing the diapers and they are constantly coming in contact with, you know, the fecal matter, the urine, you know, the saliva, because they too can actually pick it up and transmit it as well. So it is imperative that, you know, our daycare workers who work with children, that they be very careful and mindful that when you're changing the diapers, even to wipe a snotty nose. You might think it's normal, you just wipe the nose, throw away the paper, and don't even wash your hands. So these are things you have to be aware of in order to break the mode of transmission. So why is the summer, the summertime, you know, the time when we see it flourishing this much? What about the summer? Why not in spring? Why not in the winter? Why the summer? Why do we see it at this point in time? Dr. Iles, if you want to jump in here.
It may be related to the change in weather. And so it may be the fact that the virus cannot live in colder months. And so that's why you tend to see it more so in summer and into fall.
Okay. Dr. Henry, any input? Because I was reading something about, you know, that's the time when most persons probably, yes, as you said, you know, they can't survive in these colder times, but they have these recreational
activities.
These recreational activities.
Because children are on vacation, especially.
Children are on vacation, okay, and then everybody want to go to the pool. Everybody want to go, I mean, back in the day, persons go to the rivers and stuff like that, if you are from a country where you have a lot of rivers. And then, but what particularly happens there? Because people say, okay, I go to the river, but does that mean I'm going to pick up the hand, foot, and mouth disease? Just like if I could go to any river, I would just pick it up?
Well, it's rare, but especially if you go to the pools, because, you know, sometimes there are stools, feces that are released. And, you know, sometimes that is a bit off the chain.
So those persons who like to do those type of things, pee in pools.
And let's remember, you're talking about children. So you can't always stop, them from
that is true.
Doing what they need to do.
And they would swallow the water.
And then I remember I was at a pool party, and one of the little boy, he came out of the pool, and his whole abdomen was distended because he was drinking the pool water. And I'm like, oh my God. And the pool had so many other children in there. So I'm there saying, wonder what this little baby has picked up by now. So for those persons and mothers, you can train your children, do not pee in a pool if you are going to a pool party, or, because as we have just said, you can actually take that water in and you can actually get the hand, foot and mouth disease. Okay, so at this point in time, we're going to take a break and let our sponsors do their thing at QDL. And we want to thank Ms. Hanley for her continued support of the show and showing her commitment to health in the Federation of St. Kitts and Nevis.
In these uncertain times, good health is a must. Let Quality Diagnostic Laboratory provide you with fast, accurate results of the medical laboratory tests that you need. At QDL, our qualified and experienced staff can provide a host of blood, urine, and other tests in a safe, confidential, comfortable, and welcoming environment. We are open Monday to Friday from 7 a.m. to 4 p.m. and Saturdays to 12 noon. We are at the corner of Fines Avenue and Keon Street. Contact us at info@qualitydiagnosticlab.com or call 869-465-6657. And yes, si habla español. Quality Diagnostic Laboratory. Excellence in performance.
It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, yeah. One people. We are roll up to roll up, yeah. 'Cause no man's alone. Do what's right, alright. 'Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to roll up, to roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
Hello and pleasant good night. If you are just joining us, we are speaking or discussing hand, foot and mouth disease, a presentation put on by the St. Kitts Nevis Medical and Dental Association. With me in studio, I have Dr. Isles, who's the Director of Community Health Services, and I have Dr. Henry, male Henry, because we have two Henrys, Dr. Yannik Henry, who's our resident pediatrician. And of course, myself, Dr. Woodley, your host. So far, we have looked at the concept of monkeypox. It's a viral infection that affects children under the age of 10, mainly children under the age of 5. And it can also affect adults as well, but sometimes the symptoms are a bit mild. We looked at the cause, and the cause was virus, the enterovirus. And the enterovirus, it's a virus that is found in the gastro, which means stomach, intestines, tract. So it is found in the intestines. The most common virus would be the Coxsackie virus 16. And if you look at slide number 3, you would see the viruses there, Coxsackie A virus, or the Coxsackie virus A16, that's the common cause of the hand, foot, mouth disease. And also we have the echoviruses as well. Knowing that they are found in the intestine, it wasn't hard to figure out the mode of transmission or how someone can get the virus. So we looked at it, and Dr. Iles, she nicely explained to us how it is spread, and it is spread person-to-person contact, respiratory droplets when you sneeze or you cough, and touching contaminated surfaces and objects. We are now going to go into the symptoms. So follow me. We had the concept, we had the cause, we had the mode of transmission, and of course we want to know what happens when you get this virus. How does it manifest itself in the human body? So Dr. Yannik, Dr. Henry, can you kindly explain to us the symptoms? And there are so many. So we're going to share it between you and Dr. Iles. We're not going to be greedy. We're going to share it up tonight. Okay, so let us know, explain to us and teach us, because education is key. Teach us, what are the symptoms of hand, foot, and mouth disease?
Symptoms they are flu-like symptoms, as the Coxsackie virus, also A, causes the hand, foot, and mouth disease. Children often get a fever or other flu-like symptoms within 3 to 5 days after they've caught the virus. So we have fever, we have eating or drinking less, as to what we call loss of appetite. We have sore throat, and we have they are feeling unwell. These are flu-like symptoms. So they could be differentiated from other illnesses, as which we're going to speak of later on in the discussion.
It is so amazing, not to cut you off, because these flu-like symptoms, you can see it in so many things.
Things.
So this is what makes this so interesting. This is what makes medicine so interesting. I guess that's why we did it, All right, so let's continue with the symptoms.
So we have mouth sores. The child may get painful mouth sores. These sores usually start as small red spots, often on the tongue or inside of the mouth, that blister. These are signs that swallowing might be painful also with these sores. Okay, so the child will resist eating properly, drooling more than usual, and also only wanting to drink cold fluids. Okay. These are what we have under mouth sores.
Okay, so if you look at slide 8, so Dr. Iles, and in your practice, now that we're speaking about this, have you seen it? Because you're in community. Give us a little insight, because I know we have cases here, and no doubt our viewers are wondering, hey, what's the status on ground? So can you, before we get into the skin rash, what is your experience here in the island?
Well, okay, so strangely enough, I don't practice as often as I would like to, but today I would have seen a case this morning of a child. I examined the rashes because the mother was concerned whether she should return her to school or not. And so, classic, there were the rashes on the palms of the hands. However, they were healing because she had it for some time now. And she also showed some that would have been on the buttock area, which were also healing. So yes, they can occur on the palms of the hands, the soles of the feet, but they're not restricted to those areas. You can also find them on the buttock area, the legs, the arms, and sometimes the genitalia as well. It's not usually described as itchy. Sometimes there's some pain associated with the blisters. They are flat. Textbooks tend to describe them as slightly raised red lesions. However, red lesions on pale skin do not quite look the same on our complexion. So they might look a little purplish, actually, instead of just red. And so, yes, like I said, so you see red here in this Caucasian, likely to be Caucasian skin. In our populations, you tend to find them darker, so more of a purple hue than just red.
Okay, let's look at slide number 10. Okay, so here we are seeing some more, and these are actually in the mouth.
Yes, so you can imagine the pain or the discomfort that a child would experience when you have these lesions in the mouth.
And what about the severe cases we have on slide 11? So these are some severe cases of hand, foot, and mouth disease. Well, actually, this looked like a teenager or, well, an adult on the right side, because I'm seeing little mustache and beard. So I figure this is an adult. But these cases look really bad. So the cases that we have here on island, have they reached to that stage, that severity?
In terms of cases that have been reported to us, no, none of them have reached. Most of the children from the onset, maybe 2 or 3 weeks ago, most of them would have resolved by now.
Most of them would have resolved. Dr. Henry, do you have any input as it relates to the symptoms? Sometimes, you have certain little pitfalls that we don't know as it relates to symptoms. Is there anything else you can add? Well, you talking on slide 12, there was this singer's son. That's when most persons started, getting interested. This lady who sings Pink, her son had it, and actually he was actually in one of the images saying severe case. It does look, I don't know, I'm not into all of this. I'm into surgery. It does look a bit severe to me. But let me ask a question though. I see it's all up on the thigh, because when you hear hand, foot, and mouth, you just think it's restricted just to the feet, the hand, and the mouth. But I'm seeing it there on the thigh as well, so that I am assuming that can also happen.
Yes, that could also happen. As Dr. Al said, it's not restricted to the hand, foot, and the mouth.
Right.
So those are the real areas that it shows up, but it could also spread elsewhere.
So I can just have it on my hands and mouth? I can have it on my, so I can skip. So it doesn't always have to come as the triad, hand, foot, and mouth.
Yes, but that is the name.
That is the name, foot and mouth. So,
Yes.
okay, yeah, I think I'm being a little difficult. Well, if you know me, that's me.
Because remember, you have the foot and the mouth disease.
Yeah, and that is important.
Yes.
The foot and mouth disease, which is what? So speak to us about that.
Completely separate.
That is something that we find in animal populations. And so, strictly in animal populations.
And that
so
is mouth and, what is that you're speaking about? That's strictly...
That's foot and mouth.
Foot and mouth.
Right.
Foot and mouth.
Right.
So that's animals.
Yes.
But for the humans is...
Hand,
foot, mouth.
Right.
So I like doing this and not surgery because I learn a lot more.
Right.
Yeah, I mean, that's great. Okay, cool. So how do you diagnose this? I think it's, well, in my opinion, it seems to be easy because once you have, the hand, foot, and mouth lesions, I think that's it.
Classic signs.
Those are the classic signs.
Yes.
But can you expound a bit more, Dr. Henry, in terms of diagnosing this disease?
Well, to diagnosis, as you correctly said, the classic signs, the hand, foot, and mouth. We have the little rashes on the palm of the hands, the sole of the feet, and around the mouth or inside of the mouth. Also, we do blood serology, and also we do swab of the viral culture, which is some of them have little blebs there. So we do from the blisters, we just do a little swab from the blisters and we send that to the lab to be tested to isolate the Coxsackie virus itself. And also we could do cerebral fluid.
But that seems to be a bit more severe, advanced. Yes. Okay.
Because that could be a complication.
A complication, okay, which we're going to see later on. So I know most persons would be asking, oh, it could be done here? The testing can be done here? So
yes, it
can be done here. Yes. So, okay, so we don't have to send it overseas for it to be tested.
We've done that here.
And we've done it here, right, Dr. Iles? We would have isolated?
Well, I'm not certain if we would have isolated for these cases that we've been experiencing. Because we've had mild cases for the most part, yes. And so
and because of the classic symptoms.
It's a clinical diagnosis, and so when you see it, you know what it is. If there are complications, then yes, testing may occur after that.
Okay, so at this juncture, we'll take a break again, and when we get back, we would invite you, the audience, to participate in this discussion. And we'll put the numbers at the bottom of the screen when we return. So go grab a snack, apple, carrot stick, some water, leave the pizza and the hamburgers, and then come right back.
In these uncertain times, good health is a must. Let Quality Diagnostic Laboratory provide you with fast, accurate results of the medical laboratory tests that you need. At QDL, our qualified and experienced staff can provide a host of blood, urine, and other tests in a safe, confidential, comfortable, and welcoming environment. We are open Monday to Friday from 7 a.m. to 4 p.m. and Saturdays to 12 noon. We are at the corner of Fines Avenue and Keon Street. Contact us at info@qualitydiagnosticlab.com or call 869-465-6657. And yes, si habla español. Quality Diagnostic Laboratory. Excellence in performance. In these uncertain times, good health is a must. Let Quality Diagnostic Laboratory provide you with fast, accurate results of the medical laboratory tests that you need. At QDL, our qualified and experienced staff can provide a host of blood, urine, and other tests in a safe, confidential, comfortable, and welcoming environment. We are open Monday to Friday from 7 a.m. to 4 p.m. and Saturdays to 12 noon. We are at the corner of Fines Avenue and Keon Street. Contact us at info@qualitydiagnosticlab.com or call 869-465-6657. And yes, si habla español. Quality Diagnostic Laboratory. Excellence in performance.
To HealthWise by the St. Kitts Nevis Medical and Dental Association. Our motto is working towards a healthier society. And tonight in studio, I have with me Dr. Iles and Dr. Henry, and we are discussing hand, foot, and mouth disease. We have had a mouthful so far, and if you have just tuned in, you have missed quite a bit. However, we would have reruns, and you can always look at them. Now we are going into how we can prevent the spread of hand, foot, and mouth disease. We already look at the mode of transmission, and we know it is transmitted from, fecal and any other bodily fluids of someone who is infected. So we're going to speak, and it's, this disease, it's very logical. It's one of these things I would have probably aced in medical school, because it doesn't seem so hard. It doesn't seem hard at all. This is something that I would just probably do within 2 hours, go in and get 100%. So how do you prevent this? Knowing that it is spread by, bodily fluids, let's speak about prevention and infection control. Dr. Henry, let us get your views on this.
To prevent this disease, you have to wash your hands. It is a must. Just like the COVID, you have to wash your hands, because it also is, it goes from the droplets, respiratory droplets, and sometimes you sneeze, you cough, and stuff like that. So you wash your hands and with soap and water for at least 20 seconds. And if you don't have any soap or water available at that time, then you have the alcohol-based hand sanitizer that could also be used. Wash hands after changing diapers, after using the toilets, after blowing your nose, coughing or sneezing, before and after caring for anyone who is sick. Also, you clean and disinfect surfaces frequently, and areas that you've touched, shared items, especially in the schools, the children's toys, and the doorknobs.
Okay, so let's take a pin there, because remember, we're here to educate. What I realized, persons would have water available to them, and then they would use hand sanitizers. And I normally say to my patients, look, if you have water and soap, you don't use the hand sanitizer over water and soap. That's the best thing. And that's something we have to get across to our patients. Water and soap, that's the best thing. In the event that you don't have that, then you go to the hand sanitizers. And of course, these hand sanitizers have to have what percentage of alcohol? At least 70. At least 70%. So you don't get any type of cheap hand sanitizer with like 10% alcohol, because you're not doing the job correctly. So these are things you have to highlight on the line and say, hey, and when you're washing your hands, it's not just in, out. It's a proper washing. I mean, I think when we had the COVID, this seems to be like a rerun of the COVID protocols and do's and don'ts. I think that's why you have to sing the birthday song must be twice, and that's how long you should wash your hands, etc., etc. So you have to wash hands. Another thing you have brought out, Dr. Henry, is about disinfecting the toys. And here there's the doorknobs. Because we forget that, and it was so amazing during the COVID when I think I saw a video where they tracked somebody touching, and how that one person in one part of the world was able to spread just by, touching and coming in contact with inanimate objects. So I like this where they say you have to clean and disinfect doorknobs, toys of the children. So at the end of the day, when 3:30 come, don't watch go home workers. You have to step back, take the toys then, clean them, disinfect them, so that we don't spread this disease. Okay? So continue with the infection control. So that's slide number 14, yeah.
So also you have to avoid touching your eyes, your nose, and your mouth. COVID protocols also.
COVID protocols. Slide 15.
Avoid close contacts with sick people. Avoid touching someone who has hand, foot, and mouth disease, such as hugging and kissing them, as Dr. Als rightly spoke about earlier.
So what about persons like us who we can't avoid not seeing sick people? What do we do?
What do we do?
Yeah, if we can't avoid, because you said here saying avoid close contact with sick people. That doesn't pertain to us.
Well, we use our gloves, and we're really correct.
And
if it's
washing.
And you wash your hands, and especially if you're in accidental emergency, right? So you make sure you use your gloves for all patients, and you change your gloves for every patient that you use, and you wash your hands.
Okay, so we're moving on nice and slow. Can I have, the numbers are there. So if you wish to be part of this discussion, and please call in. This is very interesting. If you know of anybody out there, if you had an experience with hand, foot, and mouth disease, whether it be you or a child of yours, you can always call in, share your experience, because your experience can actually help somebody else. So the numbers to call are 466-2666 or 869-662-8674, 767-4765. And if you're overseas, I have some friends overseas who may be listening, you can always call. You can call 1-239-645-4500. Dr. Als, how do we treat this?
So treatment is really symptomatic. So you try to ensure that the child has adequate hydration and rest. If there is a fever, then we encourage persons to give what we call antipyretic. So your paracetamol, ibuprofen, never aspirin, never ever aspirin. We encourage persons to maintain personal hygiene. isolate or quarantine, isolate the affected child and quarantine for those who may be in close contact. Now we're talking about children, and so that may not be that, possible. But much of the advice that we give are to parents or the caregivers of children.
Okay, so do we had, in our situation, any patient was hospitalized?
No, not that I'm aware of. No.
Okay, and for our young mothers, not even young mothers, mothers and fathers, sorry. When do we tell them, hey, bring back your child, don't stay home? Bring back your child to the A&E department or take your child to his or her private physician. What are the bring back signs, the alert signs? Dr. Henry?
Well, the bring back signs or the alert signs, a child with high fever, and that is constant, persistent high fever. Fever that even though you give the ibuprofen, the paramol, it still stays. Even though you bathe the child. And also there's one thing that I would like to clear, that most persons will bathe their child in cold water. But cold water is not the way to bathe your child to bring a temperature down.
So what do I tell my mother?
Lukewarm water, right? That helps to break the fever. Because just for example, cold, what does a cold thing do?
Makes you shiver.
Yes, and it makes you shiver. But once you get that warm water, that warm bath for 15 to 30 minutes, it helps to bring down the fever even without antibiotics.
Oh, wow.
Okay.
So, but I remember going into tub, not even tub, my mother had this, we buy from Food Fabrics. What you call it again? It's a tub, no? That tub thing. I remember they had ice in glaze. And then I am looking at mommy, mommy, really? And then you have to go in that because that was the thing. And I think up until lately, I think that was the thing too, to bathe your child in cold water.
Yes.
So you're saying to us now, high fever, no cold water.
No cold water. Lukewarm water. Lukewarm, that is the best water to break that high fever.
That high fever. And that's one of the bring back signs. Hey, if you have a fever that's not subsiding with everything that you would have done, and you hear me say, everything you would have done, do not come to A&E and say, I didn't do anything. So if that fever is not going on with all the measures you would have taken, then to take the child back. Okay, what are some other signs? Other signs are
lethargic and the child is weak, refusing feeds and passing less urine, those are signs of dehydration. Once a child is dehydrated, then that's a cause to bring the child to the hospital, the accident and emergency room. And also rapid breathing and vomiting. Once the child is vomiting and have drowsiness or irritability or fitting, then you bring those children back to the emergency room. So these are signs to bring them to the doctor. But other than that, because the case is mild, then you could stay home and just treat the child with symptomatic treatments. Okay.
So then, Dr. Isles, so if somebody looking at this, they now would understand, because we're smart people, they would understand the signs and the symptoms. So you would say to them, just stay home, or probably call their doctor and say, look, I'm seeing X, Y, and Z, probably send a picture. Or do you advise that every mother or father who sees this, take the child to a doctor or take the child to the emergency room?
I usually encourage patients or parents, if they are truly concerned about something, then seek medical attention. So I don't recommend everyone going to A&E, but you can go to your primary care physician, whether that be in a public or private setting, your community nurse, a nurse that you're familiar with, that you trust. You can have somebody medical look at the lesions.
Okay. And as we know in medicine, you always can have complications. And although both of you have highlighted nicely that it's a mild disease, in medicine, you always have the other end of the spectrum, where you can have complications. So Dr. Isles, what are some of the complications you can, tell to our viewing audience about hand, foot, and mouth disease?
So complications associated with the disease, although rare, can occur, and so it can affect the heart or the lining of the heart, described as myocarditis. You can end up in shock, and it can result in death. There are other complications as well, such as meningitis, pulmonary edema affecting the lungs, bleeding or hemorrhage, and heart failure.
Okay. And of course, none of our cases here on Ireland.
None of our cases have
reached that thing. So actually, in terms of diet, what role diet has in all of this?
Well, good nutrition is always an effective defense against many illnesses. Your fruits, your vegetables, ensuring that your child has a balanced diet is certainly encouraged by all.
Okay. Yeah, as you said, diet goes all across the board for every sickness. Yes. A healthy diet, exercise, sunlight, getting sunlight, go outside, children behind their PlayStations, they're going outside. Okay, so let's have the numbers again, just in case anybody wants to call in and be a part of the discussion. So the numbers are 466-2666, 662-8674, 767-4765, and the overseas line is 1-239-645-4500. We are going to take a break, and we're going to listen to our sponsors, and we want to thank them dearly down at QDL, Quality Diagnostic Lab. We want to thank them dearly for supporting our show for the past year. So we're going to take a break, and when we get back, we'll be looking at some other diseases that can mimic hand, foot, and mouth disease.
In these uncertain times, good health is a must. Let Quality Diagnostic Laboratory provide you with fast, accurate results of the medical laboratory tests that you need. At QDL, our qualified and experienced staff can provide a host of blood, urine, and other tests in a safe, confidential, comfortable, and welcoming environment. We are open Monday to Friday from 7 a.m. to 4 p.m. and Saturdays to 12 noon. We are at the corner of Fines Avenue and Keon Street. Contact us at info@qualitydiagnosticlab.com or call 869-465-6657. And yes, si habla español. Quality Diagnostic Laboratory. Excellence in performance.
Meet Tom and Sarah. Meet Ben and Jerry. Sarah lives with Tom, and Ben lives with Jerry. Tom and Sarah are sexually active, and so are Ben and Jerry. But Ben and Jerry always practice safe sex, unlike Tom and Sarah. You decide which couple is protected.
Yeah, I know we can make it. It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, yeah. One people. We are roll up to roll out, yeah. 'Cause no man's alone. Do what's right, alright. 'Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to roll up, to roll out.
Bless up. Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
Okay, pleasant good night again. And we are now almost 1 hour and a half into our show. And we are speaking about hand, foot, and mouth disease. And we have discussed ably with Dr. Iles, who is the Director of Community Health Services, and our resident pediatrician, Dr. Yannik Henry, and of course myself, Dr. Woodley, your host. It has been an interesting topic so far. One, in my opinion, is very easy to understand, and our association, we come here when we can to educate you, because we figure once you're sensitized, you will take control of your health, and it would also encourage you to live healthier lives, and in so doing, improving the quality of your life. We have looked at the concept of the hand, foot, and mouth, which is caused by a virus. And this show will be aired, I think it normally airs on Thursdays, and ever so often you can see this show, or you can go on ZIZ YouTube and have a look at the show again to get all the details that we would have spoken about. But as I said, it is caused by a virus, and we have looked at the different viruses that can cause this disease. We have looked at the mode of transmission, which is normally by bodily fluids, mainly feces and urine and the saliva. We have looked at how we can break that chain of transmission, and that is almost like repeating the COVID-19 protocols: wash your hand, disinfect objects, etc., etc. Don't come in close contact with persons who are sick, and if you have to wear protective gears. For example, we as doctors, we would have to wear our gloves, our gowns, our mask, etc. if we come in contact with someone who has this disease. We have looked at the symptoms, and the symptoms are normally flu-like symptoms, but then you would have the rash, which you can see in the mouth, and you can also see on your hands. We also look at the treatment, and as Dr. Iles said, most persons aren't admitted to the hospital. The treatment is somewhat symptomatic. And as she would have highlighted, never give children aspirin. You can give them the other antipyretics, or what we would call those medication that would reduce fever. And as Dr. Henry would have said, sometimes you don't even have to get to medication. You can give your child a bath in lukewarm water, not the ice water that I was subjected to, but lukewarm water, and that would actually help to break the fever, as we would say in our medical terms. We also look at the signs to bring back your child to the hospital. These are high fever, vomiting, drowsiness, etc. So now we are going to go into certain diseases that may mimic. And before we get into that, Dr. Henry said that he had some home remedies. You know, I normally like that. And we studied in Cuba. I always have to get that plug in there. We studied in Cuba, and home remedies and, you know, homeopathy and all of those things were a very large part of our curriculum. So Dr. Henry, I'm so happy that you would have brought that. So please share with the audience exactly, you know, the home remedies for the hand, foot, and mouth disease.
Well, I'll mention just a few. So I hope that parents and caretakers at home are taking notes, because I have been posting them also on my status.
Oh yeah? Oh, cool.
From since the outbreak, and many parents message me and say, oh, thank you for that, and you know, for educating us as to how to go about doing it at home. One, eat frozen treats. Hand, foot, and mouth disease can cause serious painful symptoms from a sore throat to painful blisters like lesions inside of the mouth. One way you can help ease this discomfort is by providing your child with frozen treats. If you want to keep these treats healthy, reach for real fruit juice, frozen popsicles, or frozen yogurt. Even plain ice chips can do the trick, but make sure they don't pose a choking hazard for your child. Number 2, drink cold beverages. Along with frozen treats, cold beverages can help soothe the symptoms of a sore throat. Again, stay away from sugar-loaded drinks like sodas and artificial fruit juices. Milk, ice-cold water, or 100% fruit juices are all great options to help ease the symptoms of hand, foot, and mouth disease. Number 3, eat soft food. Since pain inside the mouth is a common symptom of hand, foot, and mouth disease, it's best to stay away from crunchy, hard foods. Instead, provide your child with soft foods that don't require much chewing. For breakfast, they can enjoy smoothies, oatmeal, waffles, and bananas. For lunch or dinner, you may want to stick to soup or stews. 4, avoid acid food and beverages. You'll want to add acid food and beverages to the avoid list while your child is recovering. Food like spaghetti sauce and beverages such as orange juice may irritate the mouth, making the sores even more painful. Other examples of acid foods include lemons, limes, tomatoes, oranges, pineapples, grapefruits, and more. Some great low acidic options include yogurt, milk, soft, fresh vegetables, and whole grains. Avoid salty and spicy foods. Salt water gargles if your child could carry out that instruction. Epsom salt bath. To ease the sores on the body, draw a bath and add 1 cup of Epsom salt. Then soak in water for 15 to 20 minutes. Epsom salts, also known as magnesium sulfate, are a chemical compound made up of magnesium, sulfur, and oxygen. The reason it's effective is that magnesium is known to help prevent inflammation by decreasing the production of inflammatory kinates in the body. Baking soda bath. I don't know if anyone know about this.
No, that's interesting. And I also like the explanation for the Epsom salt. You know, we say soaking Epsom salt, because Epsom salt seems to be good for everything. Yes. But now I understand. Interesting.
So baking soda baths. If you don't have Epsom salts on hand, a baking soda bath may just be as effective in soothing the symptoms of hand, foot, and mouth disease. Fill the tub and add a half cup of baking soda. Once the baking soda has completely dissolved, soak in the bath for 15 to 20 minutes. While there are no scientific studies to prove this is effective, anecdotal evidence advocates that these remedies can help ease inflammatory and itching symptoms. 9. Over-the-counter pain relievers. To help ease the discomfort of hand, foot, and mouth disease, an over-the-counter pain reliever may be able to help. This includes paracetamol or ibuprofen. If these home remedies and OTC medications don't work, you may need to talk to your doctor. They may prescribe a pain reliever to help relieve the discomfort caused by the disease. So this disease doesn't need any antibiotics.
Oh, great. And that's something.
No antibiotics unless there's a another infection happening.
Okay. And that's something very important that we have to highlight, because sometimes parents come into you and say, oh, give me some antibiotics now. But I'm happy that you would have underscored that, highlighted that this disease, you don't have to give antibiotic. The child or the person who is sick, the person does not need antibiotics. So that is so good. What about rice water? I remember when I had measles,
yes.
my mother bathed me in rice water.
Yes, rice water also would help.
Okay, so mommy was on the board.
Yes, she was. Not with the ice cold water.
No, not with the ice cold water, no. Not with the ice cold water. So Dr. Ives, let's go now, because a lot of things, because we don't want persons getting antsy, and everything they see, they think is hand, foot, and mouth. Okay, so we have some other entities that can actually mimic that. So one of the things that I know most persons would be asking about is monkeypox. So like, what's the difference between the monkeypox and the hand, foot, and mouth? Is it the same thing? So we have a nice picture there of the monkeypox.
Right.
So give us a little, rundown on that, so persons can know the difference between the monkeypox and the hand, foot, and mouth.
Okay, so yes, monkeypox is everywhere in terms of in the news right now. It is also caused by a virus, and it does present with rash or lesions that you see there on the screen. However, there are differences between monkeypox and hand, foot, and mouth disease. Firstly, whereas with hand, foot, and mouth disease, you tend to find it more so in children, monkeypox, at least the type that we're seeing since January 1st, I would say. So since the start of this year, are mainly in adults, is mainly in adults that we're seeing it. And more specifically, mainly seen among men. Another difference is that whereas hand, foot, and mouth disease, the incubation period, or from the time you're exposed to the time you may develop symptoms, is about 3 to 5 days. Monkeypox, on the other hand, you're talking about up to 21 days. So it's a much slower progression in terms of developing the symptoms. It's also slower in progression of the illness itself once you begin to show lesions. So hand, foot, and mouth, usually within 7 to 10 days, children will resolve of their lesions. However, with monkeypox, again, 3 weeks, maybe more, persons will have these lesions.
And do the persons with monkeypox, would they have like the flu-like symptoms as well, things like that?
They can have some flu, like many other viral infections. They can have some flu-like symptoms as well.
And as you said, the rash, it can be distributed anywhere, unlike the hand, foot, and mouth disease. There are on the hand, foot, and mouth. With monkeypox, it is the distribution. How is that?
It's different because it's what we call centrifugal. So it tends to start in the face, and then it extends towards the palms and the feet, the soles of the feet. And so that distribution in itself is different to what we would see in hand, foot, and mouth disease. Also, the lesions, in terms of how the stages of the lesions progress, it again is different from what we would see in hand, foot, and mouth.
And while before we started the show, we spoke about another entity. In human beings we have hand, foot, and mouth, but then you said in animals, what was?
Foot and mouth.
Foot and mouth. And that does not cross. So animals have foot and mouth, whereas in the human beings, we have hand, foot, and mouth. And what the animals have would not pass to us.
No.
Okay, great. All right, so what about the famous chicken pox now? So we have just dealt with monkeypox, and we compared it to hand, foot, and mouth. Dr. Henry, about the chicken pox now. Well, how can we know it's not chicken pox? Because the vesicles or, the boils, sometimes, as somebody who's not medical, you may get confused. So what is the difference between chicken pox, hand, foot, and mouth disease?
Well, as we could see on the screen, chickenpox, it is caused by the herpes virus also. Okay, and the incubation period is from 14 to 21 days. Well, hand, foot, and mouth disease could be from 3 to 5 days, and they could recover at the 10th day. Chickenpox starts from the trunk and it spreads outwards. That is one of the difference. The hand, foot, and mouth disease is hand, palm of the hands, the palm of the sole of the feet, and also the mouth. And it could spread to other parts of the bodies, but those are the clinical signs. The chickenpox rash looks like a small red bump that looks like pimples on insect bites. That's how they start. Then the blisters break, leaving an open sore which turns to a crust, or as we call it, a scab. That, as we could see on the screen there, we see some scabs there, we've seen some vesicles right there.
Like a little crater. I mean, I had chickenpox too. I had chickenpox, I had measles, I had the whole works.
The whole works.
So, trust me, I had the whole works. Because the little, like for the chickenpox, which were the little craters. In fact, I still have some, and I had that when I was in 3rd form, so that was years ago, and I still have the craters, you understand. So, I like that, where the chickenpox, it actually starts from the trunk and it spreads out. Whereas the hand, foot, and mouth, as you say, clinically, you know, the most common presentation would be the hands, the soles of the feet, and the mouth. Okay, that's cool. So now, Dr. Isles, we are looking at now measles. So how would we tell the difference between the measles, hand, foot, and mouth disease? Okay, we have a slide here, slide 19. Or Dr. Henry, whichever one who wants to jump in at this. Dr. Henry? Any one of you.
Okay, I'll speak about the measles. As we are seeing there in the images, that's what we call the couplings rash in measles. That's classical. A child has measles, you always have to look in the mouth. In the mouth. Well, for children, when we're examining children, we always have to look in the mouth. But once we see these coupling spots, right there, they're like some whitish spots. Sometimes they come as a reddish spot right there to the back of the throat also. So once we see these spots, and we see that the child, it starts from the head down to the rest of the body. Chickenpox starts from the trunk
and go out.
The measles starts from the head, come down. That's where you see the little lesions first.
And you have some, because what I can remember is some small, fine balls.
Small, fine one. We have a child there with some also. The other slide.
Okay, so that would be slide 20. Okay,
yes,
great.
Look at that. These small red brownish spots. Starts from the face and it spreads down to the extremities.
Okay.
So that's how we could differentiate, because we have to ask the parents question. Where are the spots first? On the trunk, on the palm of the hands, or in the face? Okay, and that's how we could do our differential diagnosis, to really know that it's not really hand, foot, and mouth, it's measles.
So why would I have gotten already that my immune system was down or something? That I had so many.
Remember, most of our children are vaccinated.
I'm vaccinated.
For the measles.
Against measles.
So what happened to me? Because I had that, trust me, I had chikungunya, I had everything. It's like, okay, so
measles. Sorry, not to cut you, but measles tends to be have this prodrome of a high fever and real malaise before the onset of the rashes. And so you're talking about, in med school they always mention those 3 C's: cough, coryza, and conjunctivitis. So although all rashes are not the same, and so there are things that we look for in medicine that says, it's one disease versus another.
Okay, so that was very interesting. I thoroughly enjoyed that. I want to jump over into pediatrics now.
And we also have the vaccine, as Dr. Isles correctly stated, the MMR vaccine, which is against the measles, mumps, and rubella vaccine. That is given to children at the age of 12 months and reactivate at 5 to 6 years.
Okay, well, I didn't have mom, so at least I missed something. Anyway, we're going to take one last break, and then when we get back, we'll have our doctors do their closing statement. We want to thank again QDL for their support and we're going to look at their advertisement, and we will return shortly. Okay, that was
In these uncertain times, good health is a must. Let Quality Diagnostic Laboratory provide you with fast, accurate results of the medical laboratory tests that you need. At QDL, our qualified and experienced staff can provide a host of blood, urine, and other tests in a safe, confidential, comfortable, and welcoming environment. We are open Monday to Friday from 7 a.m. to 4 p.m. and Saturdays to 12 noon. We are at the corner of Fines Avenue and Keon Street. Contact us at info@qualitydiagnosticlab.com or call 869-465-6657. And yes, si habla español. Quality Diagnostic Laboratory. Excellence in performance.
Okay, class. If you follow this algebraic expression, you must get it though. What kind of unruly class this year? What is? What going on here? How are these? Hello. Look, young lady. The choice is always yours. Okay?
Okay, welcome back to the last segment of our show, which is hand, foot, and mouth disease. And before I get into that, one of our good doctors, Dr. Tudor, told me, Dr. Woodley, remind them to clean their cell phones too. And that is very important because we are so attached to our cell phones. It's almost like another body part. And we put the phones to our ears, we talk, and when we talk, saliva go on the phone. Sometimes we might wipe our nose, we take out our phones. So what he has just mentioned, and I'm happy that he's listening and looking, and what he has just mentioned is very important, that we always have to remember to clean our phones. And I don't know how many of you do it, but many of us don't clean our phones at the end of the day. Get your hand sanitizer, wet it on a piece of napkin or tissue, and you just wipe your phone, clean it down, take off the casing too, and clean it. And what we have to realize that our children, they have so many gadgets too. Yeah. You know, we give them the phones because we want to keep them quiet. That's the new pacifier now, the cell phone. So Dr. Tudor, we really want to thank you for that. Yes, we have to clean our phones. So we're going to have our doctors, Dr. Isles, we're going to have you doing your closing statement, followed by Dr. Henry, and then we will call it a night. So Dr. Isles.
Okay, so good evening again, and I want to say thank you to you, Dr. Woodley, for inviting me here today. I think the one thing I'd like to impress upon the audience is the importance of hand washing. It is one of the most effective yet inexpensive infection prevention and control measures that we can use. And so I'm encouraging parents, children, teachers, anyone who is listening or viewing this to just encourage somebody else to say, hey, did you wash your hands? Did you remember to wash your hands? Because if it's one thing that the past 2 years has taught us is how the importance of hand washing. Let me say thank you as well to the nurses and environmental health officers who do much of these investigations and remain behind the scenes. Without them, we would not have the data that we have now, knowing that there's an outbreak of hand, foot, and mouth. So again, thank you to Dr. Woodley for having me here.
Okay, thank you, Dr. Ayers, and Dr. Henry, for you to wrap up now so we can go home.
All right. Thank you again for inviting me to speak on hand, foot, and mouth disease. As Dr. Ayers clearly stated, that it is very important to wash our hands and clean surfaces at all times. And also I would like to leave with the parents, teachers, and caretakers that this disease is a very mild disease, so don't become too worried. We just take it, it's a symptomatic disease, so you just treat your child for the fever. Remember to keep your child hydrated. Only rush to the hospital or to your doctors if you cannot, or if the child has a persistent fever, if you think that the child is dehydrated because they're not eating, or if you think that the child is breathing abnormally. These are signs to rush to A&E department, to your doctors. But this disease, as I said, it's mild, but it is highly contagious. So stay at home and isolate yourself at home for the next 5 to 7 days, and it will go away after. So thank you for listening, and I hope that you have learned something tonight about hand, foot, and mouth disease.
Okay, so I want to thank both doctors for coming on the show. They didn't give any trouble, they just accepted readily. And that's something that we encourage, we the members, the executive of the association. We also want to thank ZIZ for being here for us. Many times we come here and we leave and we don't thank you guys. And we want to thank you. We appreciate you, we see you, we feel you. And thank you for your patience with us, and thank you for what you have done for us over the past, I think, 3-4 years that we are doing this show. And of course, we want to thank you, the audience, the persons who are viewing this program, because without you, it doesn't make sense. In fact, we do this program for you. And I also want to thank those persons who would meet me, in the streets, in the supermarkets, and they would say to me, Dr. Woodley, we really enjoy the show. Please continue doing it. Sometimes we get so tired, we get so busy that we don't necessarily have the time to do it on a weekly basis. But whenever we can, we try to come here for you, the people of the Federation. So on that note, I want to wish you a lovely night. I want to wish you a great week. Please remember to be kind and do some great gesture for someone this week. Good night.